Today we will start infection. Which of the following is the main etiology of dental caries? Which of the following is the main etiology of dental caries? Streptococcus mutans. Streptococcus mutans. So the same question here. Which of the following is the main etiology of dental caries? It is Streptococcus mutans. Which of the following is the main etiology of Streptococcus mutans? Streptococcus mutans is a bacteria that naturally forms in your mouth and can build up on the surfaces of the teeth at any age, from infancy before baby teeth erupt, and even in adults who have had their permanent teeth for decades. These bacteria can be harmful as it may be a contributor to tooth decay and cavities. Tooth decay and cavities. So, which of the following is the main etiology of dental caries? Streptococcus mutans. What are the other options given here? Streptococcus purgenes, viridins, enterococcus species. So you'll choose Streptococcus mutans. Next, child 7 years was febrile and active. Child 7 years old was febrile and active. Fever controlled by antipyretics and sent home. Later, blood culture showed Streptococcus pneumoniae. Parents were asked to repeat the culture. Temperature was 39. CBC good child active. What to do? Oral antibiotics. C. Child 7 years old, febrile and active, controlled with antipyretics, sent home. Later, the blood culture showed Streptococcus pneumoniae and parents were asked to repeat culture at temperature was 39. Baby is active and CBC is good. So we will go with oral antibiotics. Let's see what is the choice given. So the choice is given: no antibiotics, oral antibiotics, IV antibiotics, IV antipyretics. See, antipyretics already he's taking orally and he's controlled. So oral and the child is active. The good thing here is the CBC is good and the child is active. So we will try with oral antibiotics. Okay, next question. Question number 3. Child with CP admitted 10 days in hospital. Child with CP admitted 10 days in hospital, then developed aspiration pneumonia. Treatment is piperacillin and vancomycin. Child with CP admitted 10 days in hospital, then developed aspiration pneumonia. Treatment is piperacillin and vancomycin. So what were the options given? Cefotaxime, clindamycin, piperacillin, vancomycin, azithromycin, ceftriaxone, imipenem. So, child with CP admitted for 10 days, then developed aspiration pneumonia. The treatment of choice is piperacillin and vancomycin. Next is the first line therapy. The first line therapy in patients with pneumocystis carinii pneumoniae, PCP, includes the following medications: trimethoprim, sulfamethoxazole. That is Bactrim. The first line therapy in patients with pneumocystis carinii pneumonia includes which of the following? That is Bactrim, trimethoprim, sulfamethoxazole. But we can see what were the other options asked. Trimethoprim plus dapsone, clindamycin plus primaquine, atavaquione alone, trimethoprim, sulfamethoxazole with corticosteroids. So you'll choose the first line therapy for pneumocystis carinii pneumonia is trimethoprim and sulfamethoxazole. Next question. Child came with bilateral swellings in front of both ears. This is mumps. That is the swelling of the parotid glands. What is common that could possibly happen for one with his age? For one within his age, meningitis with or without encephalitis 15%, if male child orchitis 20 to 30%. So what are the complications of mumps? meningitis with or without encephalitis. With or without encephalitis, the incidence of meningitis is 15%. 15% in children of months. Mumps is 15%. Meningitis with or without encephalitis is 15%, and if male child orchitis is 20 to 30%. If male child orchitis is 20 to 30%. Patient immune compromised with severe chest infection. Immunocompromised patient with severe chest infection. What is the treatment? Cefepime plus tobramycin. Cefepime plus tobramycin. Cefepime plus tobramycin. Okay. 5 years old boy was brought to the ER with a history of cat bites on face. The incident happened 2 hours ago while the child was playing with the cat at home. Physical examination revealed minor wounds on the face. Most organism in cat bite wound is the options here: Eikenella corodon, Staph aureus, Staph epidermidis, and Staph aureus, Staphylococcus epidermidis, Staph yes monoliformis, P multicida is the answer. So, same 5 years old boy was brought to ER with history of cat bites on face. Incident happened 2 hours ago. A child was playing with cat at home. Physical examination reveals minor wound on the face. Most common organism in the cat bite wounds is Pasteurella multocida. Pasteurella multocida. Pasteurella mentocida. Child came from Jizan with high fever, fatigue, myalgia. On examination, splenomegaly. Jizan, high fever, fatigue, and myalgia, and examinations. After admission, the level of consciousness start to deteriorate. What is the treatment for most common complication? Dextrose. This is cerebral malaria. This is cerebral malaria causing hypoglycemia, and cerebral malaria falciparum treatment is astisonate plus IV dexamethasone that reduce cerebral swelling in most severe form. So, child came from Jizan with high fever, and there is fatigue, malaise, and myalgia, and there is splenomegaly. After admission, the level of consciousness deteriorated. So, what is the treatment for the most common complication is dextrose. What is the most common complication you see is the hypoglycemia. And cerebral malaria falciparum treatment is at astisonate plus IV dexamethasone. Astisonate plus IV dexamethasone that reduce cerebral swelling in most severe form. Plus IV dexamethasone. Malaria is responsible for approximately 750,000 deaths in humans globally each year. Severe malaria often requires intensive care unit admission and can be complicated by cerebral malaria, respiratory distress, acute kidney injury, bleeding complications, and co-infection. Diagnostic methods range from conventional procedures like microscopy and rapid diagnostic tests to more advanced techniques like loop-mediated isothermal amplification, PCR, and molecular based point of care test. Parenteral artesunate remains the mainstay of treatment of severe and or cerebral malaria in the ICU. Parenteral artesunate remains the mainstay of treatment of severe and or cerebral malaria in the ICU, with intravenous quinine and clindamycin being considered useful alternatives in its absence. So, artesunate. Supportive care involves appropriate fluid therapy, adequate nutrition, close monitoring of complications such as seizures, hypoglycemia, and metabolic acidosis. A timely diagnosis of these complications and prompt intervention significantly reduce the mortality associated with severe and cerebral malaria. Malaria boy from G1 has splenomegaly and fever treatment. Dextrose because the complication is hypoglycemia. Child returned to school 4 days after appearance of measles rash. 4 days after appearance of measles rash. Infected people should be isolated for 4 days after they develop a rash. Diagnosis is severe malaria and the commonest complication is hypoglycemia. Dextrose for hypoglycemia, the most common complication of cerebral malaria. So the most common complication is of cerebral malaria is the hypoglycemia. So you have to consider dextrose when there is deterioration of the level of consciousness. When there is deterioration of the level of consciousness. Other options here given is acyclovir. No, it is viral treatment. Cefotoxin is bacterial, and mannitol if there is cerebral edema, but here it will be hypoglycemia. Mm. Then the following HIV related conditions are associated with advanced disease. The following HIV related conditions are associated with advanced disease except acute retroviral syndrome. Acute retroviral syndrome. Let's see the options. The options here is HIV encephalopathy, wasting syndrome. Yes, you see wasting syndrome, HIV encephalopathy with advanced disease. Pneumocystis carinii infection, again advanced disease. Cerebral toxoplasmosis is again advanced disease. So acute retroviral syndrome. The following HIV related conditions are associated with advanced disease except, yes, advanced disease you see in HIV encephalopathy, wasting syndrome, PCP infection and cerebral toxoplasmosis. So the answer is acute retroviral syndrome. Next is acute HIV infection stage. Within 2 to 4, acute retroviral syndrome is acute HIV infection stage. Within 2 to 4 weeks after HIV infection, many but not all people develop flu-like symptoms. Within 2 to 4 weeks of HIV infection, but many but not all people develop flu-like symptoms, often described as the worst flu ever. The worst flu ever. Symptoms can include fever, swollen glands, sore throats, fever, swollen glands, sore throat, muscle and joint aches, pains, and headaches. Like any viral infection, it can be fever, swollen glands, sore throat, muscle and joint pains, rash, headache. This is called acute retroviral syndrome or primary HIV infection, and its body's natural response to HIV infection. So acute retroviral infection is not advanced disease, it is the beginning of the disease. It is primary HIV infection. So within 2 weeks after HIV infection, many but not all people develop flu-like symptoms. This is called worst flu ever, and symptoms include fever, swollen glands, sore throat, rash, muscle, joint aches, pains, and headache. This is called acute retroviral syndrome or primary HIV infection. It is body's natural response to HIV infection. Which of the following antibiotic is preferred in a 25 days old neonate? Which one of the following antibiotic is preferred in a 25 days old neonate? Options azithromycin, clarithromycin, erythromycin, trimethoprim, and sulfamethoxazole. So 25 days old neonate. Option is A, azithromycin. Clarithromycin is not recommended because the safety data in this age is not available. Erythromycin is not preferred because it is substantially associated with infantile hypertrophic pyloric stenosis. Trimethoprim is contraindicated for infants less than 2 months of age because of risk of kernicterus. So the safest drug among these four options for a 25 days old neonate, azithromycin, clarithromycin, erythromycin, trimethoprim and sulfamethoxazole, is azithromycin. Clarithromycin, there is no safety data available for this age, and erythromycin is not preferred because it is associated with infantile hypertrophic pyloric stenosis. It is substantially associated with infantile hypertrophic pyloric stenosis. Trimethoprim and sulfamethoxazole is contraindicated in children less than 2 months of age because of risk of kernicterus. And also azithromycin has prokinetic action, so it is used in neonates. But you should know all these reasons. So the options and the reasons: clarithromycin not preferred because the safety data for this age is not available. Erythromycin leads to hypertrophic pyloric stenosis. Trimethoprim and sulfamethoxazole is contraindicated in less than 2 months because of risk of kernicterus. Which part of immune system is mainly destroyed in HIV infected patients? CD4 cells. CD4 cells, that is T4 lymphocytes. Which part of the immune system is mainly destroyed by HIV infection? T lymphocytes, P lymphocytes, immunoglobulins, and neutrophils. It is CD4 cells, T lymphocytes. CD4 cells, that is T4 lymphocytes. Measles, which is not transmitted to household contacts. Measles, which is not transmitted to household contacts, is called black measles. Black measles is RMSF disease caused by tick bite. Black measles. Measles which is not transmitted to household contacts is black measles. Measles which is not transmitted to household contacts is called black measles. Black measles is RMSF disease caused by tick bite. The options for this question is atypical measles, black measles, inapparent measles infection, measles in HIV infected children. Black measles is an RMSF disease caused by tick bite. Rocky Mountain Spotted Fever is a tick-borne disease. Rocky Mountain Spotted Fever is a tick-borne disease first recognized in 1896 in the Snake River Valley of Idaho. It was originally called black measles. Rocky Mountain Spotted Fever. Rocky Mountain Spotted Fever is a tick-borne disease first recognized in 1896 in Snake River Valley of Idaho. It was originally called black measles because of the look of its rash in the late stage of illness when the skin turns black. Because of the look of its rash in late stages of the illness when the skin turns black. Measles. 9 years old child presented with measles. Management include all except 9 years old child presented with measles. Management include all except yes, paracetamol, yes, vitamin A, yes, not. Aspirin. Aspirin is not the treatment of measles. Aspirin to avoid Rey syndrome. Measles management, paracetamol, vitamin A, and normal diet. Measles management, paracetamol, vitamin A, and normal diet. 3 years old male child presented with recurrent skin abscess since the age of 7 months. He has recurrent skin abscess since the age of 7 months. He is presented with fever for 10 days duration and splenomegaly. Ultrasound abdomen showed an enlarged spleen and multiple splenic abscesses. Immunoglobulins level CBP, TLC, and lymphocytes number were normal. Tonsils and lymph nodes are normal. The most likely diagnosis is chronic granulomatous disease diagnosed by hydrogen peroxide. So, 3 years old male child presented with recurrent skin abscesses since the age of 7 months. He presented with fever for 10 days duration, splenomegaly. Ultrasound abdomen showed enlarged spleen and multiple splenic abscesses. Immunoglobulins level, total leukocyte count, lymphocytes numbers were normal, tonsils and lymph nodes were normal. Viscott-Aldrich syndrome, there will be low immunity. DiGeorge syndrome will be low. Chronic granulomatous disease. Patients with Bruton's disease, X-linked A gamma globulinemia are prone to have infection. One answer is wrong. Mycoplasma, streptococcal infection, hepatitis virus infection, entero. Okay, patient with Bruton's disease, X-linked A gamma globulinemia are prone to have infection with Mycoplasma, streptococcus, hepatitis V, enterovirus, but not mycobacterium infection because the mycobacterium infection needs T lymphocytes. Patients with Bruton's disease, X-linked, are prone to have infection with, one answer is wrong, mycobacterium infection and HIV are T cells. They need T cells, not the B cells, not the A gamma. They need not the gamma globulins. So, not the immunoglobulins. They need T cells. So, mycobacterium infection. Mycobacterium infection. Pregnant woman developed German measles infection in her first trimester. German measles infection in her first trimester. Which of the following congenital abnormalities may appear in fetus? Congenital cataract. That is, German measles means rubella. German measles means rubella. Congenital rubella. Congenital rubella. You can see the classic triad in rubella. PDA, patent ductus arteriosus, cataracts and deafness, plus or minus blueberry muffin rash. PDA, cataracts and deafness, plus or minus blueberry muffin rash. Crosses placenta Congenital rubella crosses placenta when the mother has acute infection. The earlier the fetus is infected, more serious disease. The earlier the fetus is infected, more will result in serious congenital abnormalities. Hepatosplenomegaly, cataracts, mental retardation, heart patent ductus arteriosus, pulmonary stenosis. Okay. The other options given for this question is cleft palate, cleft lip, renal agenesis. We will choose congenital cataract. So 18 months old child found to have dental decay in the upper central and lateral incisors. Found to have dental decay in the upper central and lateral incisors. The most suggestive of excessive fluid ingestion, milk bottle caries. We all know that when the child carries a bottle in the mouth for a long time, they will have caries of this central and the lateral incisors, upper. If the child takes the milk bottle in the mouth for long hours, you will see caries of the upper central and lateral incisors. So this is milk bottle caries. It's not the other options are tetracycline exposure, insufficient fluid intake, failure to brush the child teeth properly. But the right answer is milk bottle caries. 18 months old child found to have dental decay in the upper central and lateral. And the most suggestive infection is the milk bottle caries. Next question. Most common cause of lymphadenitis more than 3 weeks. Most common cause of lymphadenitis more than 3 weeks is cat scratch. But the other options for this question is the bacterial virus lymphoma. So the cat scratch. Cat scratch is the most common cause of lymphadenitis more than okay, 3 months old with mild fever, running nose, mild cough, no treatment after 2 days. 3 months old with mild fever, running nose, mild cough, no treatment after 2 days, develop worsen cough. Most common cause RSV, bronchiolitis. RSV, bronchiolitis. Influenza, para-influenza, adenovirus were the other causes, but for the 3 months old, I will choose RSV, RSV. Okay, 2 months old treated with topical erythromycin after conjunctivitis for 7 days. 2 months old treated with topical erythromycin after conjunctivitis for 7 days. Now complaining of creamy whitish plaque in the tongue. 2 month old treated with topical erythromycin after conjunctivitis for 7 days. Now complaining of Creamy whitish plaque in the trunk. What is the treatment? Creamy white, oral nystatin, topical acyclovir, topical steroid, oral antibiotics. Creamy whitish plaque. Creamy whitish plaque is going with oral nystatin. Creamy whitish plaque is going with oral nystatin. Baby 3 months has 2 months old treated with topical erythromycin after conjunctivitis was addressed. Okay, baby 3 months old has pneumonia on ceftriaxone. Baby 3 months old has pneumonia on ceftriaxone treatment. Now developed dyspnea and restrictions. X-ray shows opacity in all the right lung with shift of the mediastinum to the left. Baby 3 months old with pneumonia. You can see the X-ray here. Baby 3 months old has pneumonia on ceftriaxone treatment. Now developed dyspnea and restrictions. X-ray shows opacity of the right lung with shift of the mediastinum to the left. Opacity of the right lung with shift of the mediastinum to the left. The most causative organism is Streptococcus pneumoniae. It is plural effusion. The most causative organism is Streptococcus pneumoniae, and it is plural effusion. Plural effusion. The most common organism is the Streptococcus pneumoniae. The following congenital infection is associated with diabetes type 1 in later life. The following congenital infection is associated with diabetes type 1 in later life. The options are Coxsackie B3, Coxsackie B4, CMV, rubella, and mumps. Rubella. Rubella is the option which causes type 1 diabetes in later life. Okay. 8 years old sickle cell patient arrives at the emergency room. 8 years old sickle cell patient arrives at the emergency room in respiratory distress. Over the previous several days, the child has become progressively tired and pale, and the child's hemoglobin concentration in ER is 3.1 milligram per deciliter. Which of the following viruses commonly cause such a clinical picture? Parvovirus B19. Okay, an 8 years old child with sickle cell patient arrives at emergency room in respiratory distress over the previous several days. The child has become progressively tired and pale. The child's hemoglobin concentration is 3.1. Which of the following viruses commonly causes such a clinical picture? Parvovirus B19. So the other So the other options here given is the Roseola, Coxsackie A16, cytomegalovirus, Ecovirus 11. We all know that the parvovirus B19 will cause aplastic anemia. Pictures of aplastic anemia can be formed. Blood film fever plus hepatosplenomegaly plus headache, cerebral malaria. Blood film plus fever plus hepatosplenomegaly plus headache, cerebral malaria, meningitis and leishmania, cerebral malaria. Baby with mother, hepatitis BS antigen positive. Baby with mother, HBsAg positive. What to do? Hepatitis B vaccine and hepatitis B immunoglobulin within 12 hours. Baby with mother is HBsAg positive. Mother is hepatitis B antigen positive. HBsAg positive. Then we will give hepatitis B vaccine and IgG within 12 hours. Let's see the other options here. Not just HB vaccine, not both has to be given. Hepatitis B vaccine and IgG within 12 hours. But negative HBe antigen. Child with malnourished, bronchiectasis, hepatosplenomegaly, and failure to thrive. Malnourished, bronchiectasis, hepatosplenomegaly. Stage C, stage C, stage C. Stages of HIV NBAC. Acute HIV infection, chronic HIV infection, AIDS. So, there are 3 stages of HIV infection. Acute HIV infection, develop within 2 to 4 weeks of infection. The virus simply multiply rapidly all over the body, very high level in the body, highly infectious, destroying CD4 cells, flu-like symptoms, headache, fever with rash. Chronic HIV infection take about 10 years without anti-HIV treatment to reach AIDS. Take about 10 years without anti-HIV treatment to reach AIDS. Less viral concentration in the blood and less multiplication, asymptomatic, clinical latency, still can transmit infection. AIDS, opportunistic infections or infections and infection-related cancers. CD4 count is less than 200 cells per millimeter cube. Survival for about 3 years. So stage A, B, and C. Stage A, B, and C. So stage C, stage A, B, and C. Drug abuser with infective endocarditis. Blood cultural sensitivity mostly shows. Drug abuser with infective endocarditis. Streptococcus epidermidis. No way. Child with leukemia, he has septicemia from venous line. The organism is Pseudomonas. Child with leukemia, he has septicemia from venous line. The organism is Pseudomonas. Child with chicken pox developed secondary bacterial infection. What is the treatment? Penicillin and clindamycin. Skin infection by streptococcus. Child with chicken pox developed secondary bacterial infection. What is the treatment? Penicillin and clindamycin. Skin 14 years MR develop fever, hematuria, arthralgia, splenomegaly. His drug abuser. Develop fever, hematuria, arthralgia, and splenomegaly. His drug abuser. Pseudomonas or Streptococcus viridans. The patient on chemotherapy and has fever with pyoderma. Patient is on chemotherapy and has fever with pyoderma. What is the treatment? Penicillin and gentamicin. Patient has chemotherapy and has fever with pyoderma. What is the treatment? Penicillin and gentamicin. 9 months old, fever in between. He is playful. He is 9 months old, fever in between. He is playful, no meningitis sign. Chest is clear. Investigations done show WBC is 20,000. Neutrophilia, you made blood culture and sensitivity. What do you predict? 9 months with fever in between, playful, no meningitis sign, chest is clear. And Streptococcus pneumoniae. Gentamicin. This medication may cause sensory neural hearing loss in children. That is gentamicin. We all know that there is side effect of gentamicin is sensory neural hearing loss. What other things is very other option? A child with acute abdominal pain, abdominal tenderness, testicular edema. Acute abdominal pain, abdominal tenderness, testicular edema. What is the diagnosis? Streptococcus pneumonia, Klebsiella, Staph aureus, and E. coli. E. coli is the most common cause of UTI. E. coli is the most child with acute abdominal pain, abdominal tenderness, testicular edema. What is the diagnosis? E. coli. Epididymis is a diagnosis and E. coli is the commonest organism. Acute abdominal pain, abdominal tenderness, acute abdominal pain, abdominal tenderness, acute abdominal pain, abdominal tenderness, testicular edema. What is the diagnosis? E. coli. Epididymis is the diagnosis and E. coli is the causative organism. Epididymitis is the diagnosis and E. coli is the causative organisms. E. coli is the most common cause of in patients on theophylline therapy for asthma, certain other drugs change theophylline clearance and raise or lower the theophylline levels. Which of the following medications may be safely administered with theophylline? Penicillin. Penicillin may be safely administered with theophylline. But the other options given here is the erythromycin, cimetidine, phenytoin, and rifampicin. So penicillin can be safely administered with theo. Infective endocarditis plus recurrent heart disease. Streptococcus viridans. Treatment penicillin and gentamicin. Infective endocarditis in addict is staph aureus. Infective endocarditis in addict is staph aureus. Infective endocarditis plus recurrent heart disease, Streptococcus viridans. The most common treatment is penicillin and gentamicin. Infective endocarditis in addict is staph aureus. Infective endocarditis plus recurrent heart disease, Streptococcus viridans. What is the treatment? Penicillin and gentamicin. Infective endocarditis in addict is the staph aureus. If no associated heart disease, staph. If associated with heart disease, pseudomonas. Infective endocarditis in addict. If no associated with heart disease, staph. If associated with heart disease, pseudomonas. Staph aureus is the most common pathogen in isolated tricuspid valve endocarditis. Staph aureus is the most common pathogen in isolated tricuspid valve, accounting for 50 to 60% of cases among IV drug users. And Staph aureus is sufficiently virulent to infect valves that do not have pre-existing disease. Which type of organism may most commonly cause endocarditis in intravenous drug abuse? Staph aureus is the most common pathogen in isolated tricuspid valve endocarditis, accounting for 50 to 60% of the cases among IV drug users. Staph aureus is sufficiently virulent to infect the valves which do not have pre-existing disease. See, staph aureus, if no associated, if there is if see, infective endocarditis in IV drug abusers, if the person has no heart disease before, the commonest organism is staph aureus. But if he has a heart disease before, then the commonest organism is the pseudomonas. I think these questions we read it before here. Just a second here. Drug abusers with infective endocarditis, blood culture mostly will show. You can write staph aureus also here. Pseudomonas if they have heart disease before, okay? Don't get confused. Infant born to HIV positive mother, what to do for him first? Give him zidovudine. Zidovudine. Infant born to HIV positive mother, what to do for him first? Give him zidovudine. Do HIV DNA PCR, do HIV DNA PCR, do Western blot test. Give him zidovudine. Do HIV DNA PCR, do Western blot test. For 6 weeks, after birth, baby is born to women with HIV. For 6 weeks after birth, babies born to women with HIV receive an HIV medicine called zidovudine, brand name Retrovir. For 6 weeks after birth, babies born to women with HIV receive an HIV medicine called zidovudine, brand name Retrovir. The HIV medicine protects the babies from infection with any HIV that passed from the mother to child during childbirth. The HIV medicine protects the babies from infection with any HIV that passed from mother to child during childbirth. HIV testing for babies born to women with HIV is recommended at 14 to 21 days after birth, at 1 to 2 months, and again at 4 to 6 months. The test used is called a virologic HIV test, looks directly for HIV in the blood. So you should know certain things about infant born to HIV positive mother. What is the first thing you will give? You will give zidovudine. For 6 weeks after the birth of the infant, the antiviral zidovudine is given for the infants born to HIV positive mother. What does this medicine do? The HIV medicine protects the babies from infection with any HIV that passed from mother to child during childbirth. HIV testing for babies born to women with HIV is recommended at 14 to 21 days, then at 1 to 2 months, then at 4 to 6 months. The test used is called virologic HIV test, looks directly for HIV in blood. A rash on the neck of newborn. Treatment, nystatin. A rash on the neck of newborn. Treatment, nystatin. Rash on the neck of newborn. What is the treatment? Nystatin. 10 months old. 10 months old fever, continue for 12 to 24 hours, then resolved. 10 months old had fever, continue for 12 to 24 hours, then resolved. Then papillary rash appears in the trunk and neck in the fourth day. Means first there was fever, high grade, probably for 2 to 3 days, then resolved. Then there is a papillary rash appear in the trunk and neck, in the fourth day of fever. On examination mouth, we suspect to see Nagayama spot. The diagnosis is roseola infantum. Nagayama spot. The diagnosis is roseola infantum. Uvulopalato-glossal spots, also referred to as Nagayama spots. Uvulopalato-glossal spots, also referred to as Nagayama spots, or erythematous papules found on the soft palate and uvula. Uvulopalato-glossal spots, also referred to as Nagayama spots, or erythematous papules found on the soft palate and uvula, that are seen in two-thirds of the patients. Upon rapid defervescence of the fever around days 3 to 5, small rose pink or red 2 mm to 5 mm papules and macules will develop. Roseola is caused by virus, usually human herpes virus 6 or sometimes human herpes virus 7. It spreads by contact with infected person's saliva, such as when sharing a cup, or through the air, such as when the person of the roseola causes or sneezes. So, roseola infantum. Nagayama spots is seen in roseola infantum. Koplik spots in measles. Roth spot, rose spot. I don't know about the rose spot. So Nagayama spot. Lower leg skin lesion, round. Lower leg skin lesion, round, not treated by topical antifungal or not improved. Lower leg skin lesion, round, not treated by topical fungal or not improved. Granuloma annulare. Granuloma annulare. Granuloma annulare is a skin condition that is caused as a raised rash or bumps in a ring pattern. Granuloma annulare is a skin condition that causes a raised rash or bumps in ring pattern, usually on the hands and feet. Granuloma annulare is a skin condition that causes raised rash or bumps in a ring pattern. The most common type affects young adults, usually on the hands and feet. Cause of recurrent erythema multiforme, herpes simplex virus. Cause of recurrent erythema multiforme, herpes simplex virus. HHV6 causes roseola infantum. Cause of recurrent erythema multiforme is herpes simplex virus. Herpes simplex virus. HHV6 is roseola infantum. Neonate with rash on face and chest, white papule on with erythematous base and eosinophil. Erythema, toxic neonate with rash on the face and chest, white papule on erythematous base and eosinophil. Erythema, toxicum. Erythema. Treatment, pneumocystis. Treatment of pneumocystis carinii in HIV. First line, trimethoprim and sulfamethoxazole. Resistant cases, you can give pentamidine or sulfamethoxazole plus dapsone or primaquine. So the first line treatment is and sulfamethoxazole. In resistant cases, can give pentamidine or trimethoprim sulfamethoxazole plus dapsone or primaquine or clindamycin. Infant not gaining weight, hepatomegaly and hydrocephaly and murmur. Infant not gaining weight, that means failure to thrive, hepatomegaly, hydrocephalus, murmur. The cause is torch sepsis, congenital heart disease, pneumonia, no torch sepsis, because he has failure to thrive, hepatomegaly, hydrocephalus, murmur. So torch sepsis. First line, trimethoprim sulfamethoxazole, resistant cases, pentamidine, second line, or mother with herpes ask about lactation. Mother with herpes ask about lactation. Give breastfeeding, no problem. Mother with herpes ask about lactation. Give breastfeeding, no problem. To differentiate between Epstein-Barr virus and cytomegalovirus causing infectious mononucleosis, heterophile AB, heterophile AB, heterophile AB, antrophil antibodies, heterophile antibodies. Neutrophil antibody tests are rapid, cheap, and specific tests that can be performed from the onset of symptoms of infectious mononucleosis. Heterophile antibody tests are rapid, cheap, and specific tests that can be performed from the onset of symptoms of infectious mononucleosis. In adolescents, heterophile antibody tests have high specificity and sensitivity in diagnosis of primary acute EBV infection. To differentiate EBV and CMV from infectious mononucleosis is heterophile antibody. 10-year-old boy appears with history of purulent discharge from the left ear for the last 5 days. Past medical history inserted tympanoplasty tube was placed in his left ear 12 months ago due to recurrent purulent left otitis media. The child is afebrile. He denies any history of headache, dizziness, and vomiting. He likes to swim. He's doing well in school. Physical examination reveals purulent elevation discharge from the left ear through tympanostomy tube. The most common organism responsible for discharge through tympanostomy tube is Staph aureus, Streptococcus pneumoniae, Staphylococcus epidermidis, Pseudomonas aeruginosa, Candida. Streptococcus pneumoniae. Streptococcus pneumoniae is the most common organism. The most common organism responsible for discharge through tympanostomy tube. The most common organisms responsible for discharge through tympanostomy. However, Staph aureus and Pseudomonas aeruginosa are found more often in tube otorrhea than acute otitis media because they are commonly found in external auditory canal and can penetrate the middle ear through the tympanostomy tube. Otorrhea might resolve spontaneously or might require antimicrobial treatment. So, Staph aureus and Pseudomonas aeruginosa are the most common tube associated organism. So the option here we have to choose Staph aureus. So we have to choose the option here is Staph aureus, not the Streptococcus pneumoniae. Child 2 years, ataxia since 1 week with acute onset. Mother tell you he had rash at the age of 2 months. Child 2 years old, ataxia since 1 week. Child is 2 years old. He's 2 years old. Ataxia since 1 week. Child 2 years old, ataxia since 1 week with acute onset. Mother tell you that he had rash at the age of 2 months. Which is the most likely infection? Measles. Child 2 years old, ataxia since measles. Child with neutropenia. What antibiotic to give? Tazobactam or gentamicin. Child with neutropenia. What antibiotics to give? Tazobactam or gentamicin. Chest X-ray and there is pneumothorax, commonest causative organism, Staph aureus, Staph aureus. Chickenpox since 1 week. Chickenpox since 1 week, circular lesions in thigh, erythema, tender swelling, cellulitis, causative organism, Streptococcus pyogenes. Chickenpox since 1 week, circular lesion in thigh, erythema, tender swelling, cellulitis, causative organism is Streptococcus pyogenes. HIV, come to clinic 6 months old. HIV, come to clinic 6 months old. What medication you will give? Iron for Iron for plus prophylaxis of pneumocystis carinii pneumonia. Iron plus. HIV came to clinic 6 months old. What medications will get? Iron plus prophylaxis of pneumocystis carinii pneumonia.